Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Colchicine in acute myocardial infarction. Background. Inflammation is associated with adverse cardiovascular events. Data from recent trials suggest that colchicine reduces the risk of cardiovascular events. Results. A total of 7,062 patients at 104 centers in 14 countries underwent randomization. At the time of analysis, the vital status was unknown for 45 patients, 0.6%, and this information was most likely missing at random. A primary outcome event occurred in 322 of 3,528 patients, 9.1%, in the colchicine group, and 327 of 3,534 patients, 9.3%, in the placebo group, over a median follow-up period of 3 years. Hazard ratio, 0.99, 95% confidence interval, C 0.85 to 1.16, P equals 0.93. The incidence of individual components of the primary outcome appeared to be similar in the two groups. The least squares mean difference in C-reactive protein levels between the colchicine group and the placebo group at 3 months, adjusted according to the baseline values, was minus 1.28 mg per liter, 95% C, minus 1.81 to minus 0.75. Diarrhea occurred in a higher percentage of patients with colchicine than with placebo, 10.2% versus 6.6%, P less than 0.001, but the incidence of serious infections did not differ between groups. Conclusions. Among patients who had myocardial infarction, treatment with colchicine, when started soon after myocardial infarction and continued for a median of 3 years, did not reduce the incidence of the composite primary outcome, death from cardiovascular causes, recurrent myocardial infarction, stroke, or unplanned ischemia-driven coronary revascularization. Routine spironolactone in acute myocardial infarction. Background. Mineralocorticoid receptor antagonists have been shown to reduce mortality in patients after myocardial infarction with congestive heart failure. Whether routine use of spironolactone is beneficial after myocardial infarction is uncertain. Results. We enrolled 7,062 patients at 104 centers in 14 countries. 3,537 patients were assigned to receive spironolactone, and 3,525 to receive placebo. At the time of our analyses, the vital status was unknown for 45 patients, 0.6%. For the first primary outcome, there were 183 events, 1.7 per 100 patient years, in the spironolactone group, as compared with 220 events, 2.1 per 100 patient years, in the placebo group over a median follow-up period of 3 years. Hazard ratio adjusted for competing risk of death from non-cardiovascular causes, 0.91, 95% confidence interval, C 0.69 to 1.21, P equals 0.51. With respect to the second primary outcome, an event occurred in 280 of 3,537 patients, 7.9%, in the spironolactone group, and 294 of 3,525 patients, 8.3%, in the placebo group. Hazard ratio adjusted for competing risk, 0.96, 95% C, 0.81 to 1.13, P equals 0.60. Serious adverse events were reported in 255 patients, 7.2%, in the spironolactone group, and 241, 6.8%, in the placebo group. Conclusions. Among patients with myocardial infarction, spironolactone did not reduce the incidence of death from cardiovascular causes, or new or worsening heart failure, or the incidence of a composite of death from cardiovascular causes, myocardial infarction, stroke, or new or worsening heart failure. Phase 3 trial of Cabozantinib to treat advanced neuroendocrine tumors. Background. Treatment options for patients with advanced neuroendocrine tumors are limited. The efficacy of Cabozantinib in the treatment of previously treated, progressive extrapancreatic or pancreatic neuroendocrine tumors is unclear. Cabozantinib, as compared with placebo, significantly improved progression-free survival in patients with previously treated, progressive advanced extrapancreatic or pancreatic neuroendocrine tumors. Adverse events were consistent with the known safety profile of Cabozantinib. Evolving Epidemiology of Mpox in Africa in 2024. Background. For decades after the identification of Mpox in humans in the Democratic Republic of Congo, DRC, in 1970, the disease was largely confined to the rural areas of Central and West Africa, and thus did not garner broad attention. On August 13, 2024, Mpox was declared a public health emergency of continental security (FEX) by the Africa Centers for Disease Control and Prevention, Africa CDC, a notice that was followed the next day by a declaration of a public health emergency of international concern, FIEC, by the World Health Organization. Conclusions. The high Mpox disease burden in Africa, especially in the DRC, with a rising number of cases, high case fatality rate, and high degree of spread to other previously Mpox-free African countries, is cause for increased international concern. Case detection, contact tracing, public health measures, and affordable vaccines are needed to implement interventions in the DRC to reduce the risk of global spread of the virus. Next, we will be discussing articles from Journal of American Medical Association. U.S. abortion bans and fertility. Question: was adoption of complete or 6-week abortion bans associated with differential changes in fertility rates? Findings. There were an estimated 1.01 additional births above expectation per 1,000 reproductive aged females in states following the adoption of abortion bans, 60.55 observed versus 59.54 expected. 1.70% increase, equivalent to 22,180 excess births. Estimated differences were largest among racially minoritized individuals, those without a college degree, Medicaid beneficiaries, unmarried individuals, younger individuals, and those in southern states. Meaning estimated differences in fertility associated with abortion bans were largest among people experiencing structural disadvantage, and in states with among the worst maternal and child health outcomes. Next, we will be discussing articles from Annals of Internal Medicine. Effectiveness of the 2023 to 2024 XBB.1.5 COVID-19 vaccines over long-term follow-up, a target trial emulation. Background. Monovalent COVID-19 vaccines targeting the XBB.1.5 Omicron variant were introduced in September 2023. In the absence of randomized controlled trials demonstrating their efficacy, information on real-world vaccine effectiveness, VI, is needed. Conclusion. COVID-19 vaccines targeting the XBB.1.5 variant of Omicron were not effective in preventing infection and had relatively low VA against hospitalization and death, which declined rapidly over time. Next, we will be discussing articles from British Medical Journal. Stroke and Myocardial Infarction with Contemporary Hormonal Contraception, Real-World, Nationwide, Prospective Cohort Study. Objective: to evaluate the association between contemporary hormonal contraceptive use and the risk of incident ischemic stroke and myocardial infarction. Conclusions. Use of contemporary estrogen, progestin, and progestin-only contraceptives was associated with an increased risk of ischemic stroke and, in some cases, myocardial infarction, except for the levonorgestrel-releasing intrauterine device, which was not associated with either. Although absolute risks were low, clinicians should include the potential risk of arterial thrombosis in their assessment of the benefits and risks when prescribing a hormonal contraceptive method. Next, we will be discussing articles from Lancet. Life expectancy losses in the Gaza Strip during the period October 2023 to September 2024. Background. In the context of the ongoing war in the Gaza Strip, the Gaza Health Ministry (GHM) has reported 45,936 fatalities and more than 10,000 individuals missing or under the rubble for the period October 7, 2023 to January 8, 2025. The scope of this death count is difficult to fully interpret because it does not account for the size and age distribution of the Gaza Strip population. Moreover, the quality of this death count has been questioned. In this study, we evaluated the quality of the GHM death count by comparing GHM data against registered data, and we estimated life expectancy losses in the Gaza Strip for the period October 2023 to September 2024, the first 12 months of the war. Interpretation. Our approach to estimating life expectancy losses in this study is conservative as it ignores the indirect effect of the war on mortality. Even ignoring this indirect effect, results show that the ongoing war in the Gaza Strip generated a life expectancy loss of more than 30 years during the first 12 months of the war, nearly having pre-war levels. Actual losses are likely to be higher. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Journal of Clinical Oncology. Trastuzumab Duocarmazine in pretreated human epidermal growth factor receptor 2 positive advanced or metastatic breast cancer. An open-label, randomized, phase 3 trial, TULIP purpose. Human epidermal growth factor receptor 2, HER2 targeted therapy is standard of care for HER2 positive, HER2+ breast cancer. But most patients develop progressive disease with persistent HER2 expression. No definitive treatment guidance currently exists beyond second line. Trastuzumab Duocarmazine, T-Duo, is a third-generation, HER2-targeted antibody-drug conjugate that demonstrated efficacy and acceptable safety in phase I studies of heavily pretreated patients, with HER2+/HER2-low breast cancer. Conclusion. Treatment with T-Duo was manageable, but tolerability was affected by prevalent ocular toxicity, leading to a higher discontinuation rate in the T-Duo arm. T-Duo significantly reduced the risk of progression in patients with advanced HER2+ breast cancer who have progressed during/after greater than or equal to 2 HER2-targeted therapies, or after T-DM1. Here are the articles from Journal of Hepatology. PEG-IFN alpha-2 reduces relapse in EBIAG-negative patients after nucleoside analog cessation. A randomized controlled trial. Switching to PEG-IFN alpha reduces virological relapse and increases HBsAg loss after nuke cessation in ABAG patients. ABAG patients with HBsAg less than 10 IU/ml have a high likelihood of HBsAg clearance when switching from nukes to PEG-IFN alpha. Discontinuation is not appropriate in patients with HBsAg greater than 1000 IU/ml due to high relapse rate and poor HBsAg clearance. It is safe to switch from nukes to PEG-IFN alpha in ABAZ patients without significant fibrosis or cirrhosis. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Multimodal profiling of peripheral blood identifies proliferating circulating effector CD4+ T cells as predictors for response to integrin alpha-4 beta-7 blocking therapy in inflammatory bowel disease. Background and aims. Despite the success of biological therapies in treating inflammatory bowel disease, managing patients remains challenging due to the absence of reliable predictors of therapy response. Conclusions. These findings provide a reliable predictive classifier with significant implications for personalized inflammatory bowel disease management. Here are the articles from Clinical Gastroenterology. Endoscopic submucosal dissection criteria for differentiated type early gastric cancer are applicable to mixed type differentiated predominant. Background. There is a lack of sufficient evidence on whether mixed type differentiated predominant early gastric cancer, MD-EGC, can be treated endoscopically by referring to the criteria for differentiated type early gastric cancer, EGC. This study aims to evaluate the efficacy of endoscopic submucosal dissection, ESD, in MD-EGC. Conclusions. Despite the greater malignancy and lower endoscopic curative resection rate of MD-EGC, patients who met curative resection had a favorable long-term prognosis. Next, we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Oral versus intravenous antibiotic therapy for Staphylococcus aureus bacteremia or endocarditis, a systematic review and meta-analysis of randomized controlled trials. Background. We conducted a systematic review of randomized controlled trials, RCTs, to generate more precise estimates of the efficacy and safety of oral versus intravenous antibiotic therapy for Staphylococcus aureus bacteremia or endocarditis. Conclusions. In this systematic review of RCTs comparing oral with intravenous antibiotic therapy for S. aureus bacteremia or endocarditis, few studies met the eligibility criteria for inclusion. Meta-analysis of these studies suggests that transitioning from intravenous to oral therapy is likely effective in a subgroup of carefully selected patients. Additional randomized trials are necessary before transition to oral therapy can be routinely recommended. Next, we will be discussing articles in the field of rheumatology. Here are the articles from Arthritis and Rheumatology. Social connections in older adults with systemic lupus erythematosus, patient perspectives. Objective. Interpersonal relationships are crucial to healthy aging. Social isolation is associated with multiple adverse health outcomes in older adults, including depression. Those with chronic conditions, such as systemic lupus erythematosus, SLE, may be particularly vulnerable to social isolation. In this qualitative study, we elicited lived experiences of older adults with SLE related to social connections and emotional health. Conclusion. Social isolation was commonly reported by older adults with SLE. Larger observational studies are needed to improve characterization of social isolation in this population and understand its association with depression and other adverse health outcomes. Investigational studies integrating strategies to improve social isolation in older adults with SLE may improve their health and well-being. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. A proteomics-based approach for prediction of different cardiovascular diseases and dementia. Background. Many studies have explored whether individual plasma protein biomarkers improve cardiovascular disease risk prediction. We sought to investigate the use of a plasma proteomics-based approach in predicting different cardiovascular outcomes. See inclusions. Measurement of targeted protein biomarkers produced superior prediction of aggregated and disaggregated cardiovascular events. This study represents proof of concept for the application of targeted proteomics in predicting a range of cardiovascular outcomes. Here are the articles from Journals of the American College of Cardiology. Higher aircraft noise exposure is linked to worse heart structure and function by cardiovascular MRI background. Aircraft noise is a growing concern for communities living near airports. Objectives. This study aimed to explore the impact of aircraft noise on heart structure and function. Conclusions. Higher aircraft noise exposure associates with adverse LV remodeling, potentially due to noise increasing the risk of obesity and hypertension. Findings are consistent with the existing literature on aircraft noise and cardiovascular disease, and need to be considered by policymakers and the aviation industry. From JAMA Cardiology, Cerebral Embolic Protection by Geographic Regina Post hoc analysis of the Protected TAVR randomized clinical trial. Question. Are there regional differences in the association between use of cerebral embolic protection, CEP, and stroke outcomes in patients undergoing transcatheter aortic valve replacement, TAVR? Findings in the Protected TAVR randomized clinical trial, including 3,000 patients, no significant difference was found in stroke rates with CEP, nor in interaction by geographic region. Exploratory analysis showed a possible association between CEP use and reduced stroke rates in the U.S. cohort, but not in the outside the U.S. cohort, meaning although the trial did not show a significant effect of CEP overall, exploratory findings suggest potential regional differences that require further research to assess if patient or procedural factors influence CEP efficacy. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. The association between thyroid differentiation score and survival outcomes in papillary thyroid carcinoma. Context: Thyroid differentiation score, TDS, calculated based on mRNA expression levels of 16 genes controlling thyroid metabolism and function, has been proposed as a measure to quantify differentiation in papillary thyroid carcinoma, PTC, objective. The objective of this study is to determine whether TDS is associated with survival outcomes across patient cohorts. Conclusion: TDS quantifies the spectrum of differentiation status in PTC and may serve as a potential prognostic biomarker in PTC, mostly promisingly in BRAF 600E mutated tumors. Here are the articles from Diabetes Care. Osteoprogesterone, osteopontin, and osteocalcin are associated with cardiovascular events in type 2 diabetes. Insights from Excel. Objective: to evaluate the association of 4 bone metabolism biomarkers, osteoprogesterone, osteopontin, sclerostin, and osteocalcin, with cardiovascular events in people with type 2 diabetes, T2D. Conclusions: higher levels of osteoprogesterone and osteopontin are associated with an increased risk of CV events in people with T2D, supporting the hypothesis that pathways involved in bone metabolism play a role in CV disease. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Chemotherapy-related cognitive impairment and changes in neural network dynamics, a systematic review. Background and objectives. This systematic review aims to synthesize the current literature on the association between chemotherapy, CTX, and chemotherapy-related cognitive impairment, CRCI, with functional and structural brain alterations in patients with non-central nervous system cancers. Discussion. While there is evidence suggesting CTX affects brain connectivity and neural network dynamics that can lead to cognitive difficulties, the findings are inconsistent. More robust and standardized research is needed to conclusively determine the extent of these effects, and to develop targeted interventions for mitigating potential cognitive impairments in patients undergoing systemic treatment. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Clinical characteristics and prognosis of patients with severe pneumonia, with pneumocystis jirovecii colonization. A multi-center, retrospective study. Background. For decades, the incidence and clinical characteristics of pneumocystis jirovecii colonization in patients with severe pneumonia was unclear. Research question: what are the clinical features and outcomes associated with P. jirovecii colonization in individuals diagnosed with severe pneumonia? Interpretation. Immunosuppression and a reduced lymphocyte count were identified as risk factors for P. jirovecii colonization in patients with non-pneumocystis pneumonia. More frequent detection of various viruses was observed in patients colonized with P. jirovecii, and P. jirovecii colonization was associated with an increased 28-day mortality in patients with severe pneumonia. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Effective triple therapy on cardiovascular and severe cardiopulmonary events in chronic obstructive pulmonary disease, a post-hoc analysis of a randomized, double-blind, Phase 3 clinical trial, ethos rationale. Chronic obstructive pulmonary disease, COPD, is associated with an increased risk of cardiovascular and cardiopulmonary events. In the Phase 3 52-week ethos trial, NCT 024655567, triple therapy with budesonide/glycopyrrolate/formoterol fumarate, BGF, reduced rates of moderate/severe exacerbations and all-cause mortality compared with dual therapy with glycopyrrolate/formoterol fumarate, GFF, or budesonide/formoterol fumarate, BFF. However, the effect of BGF on cardiovascular events versus GFF remains unevaluated. Furthermore, the effect of BGF on time to first severe exacerbation has not been reported. Objectives: to assess the effects of BGF 320/18/9.6G, BGF 320, and other inhaled corticosteroid-containing arms on cardiovascular and severe cardiopulmonary endpoints, versus GFF in patients with COPD from the ETHOS trial. Conclusions: BGF had a benefit on cardiovascular endpoints and severe cardiopulmonary events versus GFF in patients with moderate to very severe COPD. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Effective triple therapy on cardiovascular and severe cardiopulmonary events in chronic obstructive pulmonary disease. A post-hoc analysis of a randomized, double-blind, phase 3 clinical trial, ETHOS rationale. Chronic obstructive pulmonary disease, COPD, is associated with an increased risk of cardiovascular and cardiopulmonary events. In the phase 3 52-week ETHOS trial, NCT 024655567, triple therapy with budesonide/glycopyrrolate/formoterol fumarate, BGF, reduced rates of moderate/severe exacerbations and all-cause mortality compared with dual therapy with glycopyrrolate/formoterol fumarate, GFF, or budesonide/formoterol fumarate, BFF. However, the effect of BGF on cardiovascular events versus GFF remains unevaluated. Furthermore, the effect of BGF on time to first severe exacerbation has not been reported. Objectives: to assess the effects of BGF 320/18/9.6G, BGF 320, and other inhaled corticosteroid-containing arms on cardiovascular and severe cardiopulmonary endpoints, versus GFF in patients with COPD from the ETHOS trial. Conclusions: BGF had a benefit on cardiovascular endpoints and severe cardiopulmonary events versus GFF in patients with moderate to very severe COPD. Here are the articles from Kidney International Reports. Cost-effectiveness of clinical decisions support to improve CKD outcomes among First Nations Australians. Introduction. The Northern Territory, NT, is a hotspot for chronic kidney disease, CKD, and has a high incidence of kidney replacement therapy, KRT. The Territory Kidney Care Clinical Decision Support, CDS, tool aims to improve diagnosis and management of CKD in remote NT, particularly among First Nations Australians. We model the cost-effectiveness of the CDS versus usual care conclusion. Territory Kidney Care is highly cost-effective when it supports early diagnosis of CKD and increases optimal management in diagnosed patients. These results support investing in CDS tools, implemented in strong partnerships, to improve outcomes in settings with a high burden of CKD.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.